Hello everyone, welcome back. Today we're going to do the first in the vascular surgery series and we're going to be speaking about varicose veins. So, the image on the right shows a picture of varicose veins. Varicose veins are essentially dilated and tortuous superficial veins, as they are described in many exam questions, and they commonly affect the lower limbs. They've developed due to the incompetence of the valves between the deep and the superficial venous systems, which may result in retrograde flow and pooling of blood in the superficial venous system. Varicose veins are very common and they can affect up to a third of adults, particularly those with advancing age. Women are also more commonly affected than men due to hormonal changes. And individuals with a family history of varicose veins or who have occupations that involve prolonged periods of standing are also at increased risk of varicose veins. Other potential causes and risk factors that may lead to the development of varicose veins is anything that is linked with venous insufficiency or valve incompetence. So, as well as advanced age and female sex and family history, obesity can also lead to varicose veins, as well as we said, prolonged periods of standing, occupations which lead to prolonged standing or lack of movement, and hormonal factors such as an increased levels of progesterone during pregnancy and from the oral contraceptive pill. And this is because increased progesterone levels during pregnancy and the oral contraceptive pill can lead to the dilation of the veins and valve dysfunction. So a typical exam question will uh, point towards a dilated or tortuous veins, which meaning very visible superficial veins. There may be also a cramping sort of pain of the lower limb or a heaviness, as well as edema, which is swelling. There may be also further complications such as venous ulcers in advanced cases, skin discoloration due to the hemosiderin deposits, which can lead to increased skin discoloration, and there's also a risk of hemorrhage in varicose veins. Now, first line to diagnose varicose veins, we can do various of investigations. The first line and gold standard being a Doppler ultrasound. Doppler ultrasound can provide information on the anatomy of the veins and the competence of the valves. And the second line, we can also use duplex ultrasound, which is used to measure the blood flow and detect any blockages or abnormalities of the veins. We can also have a go at venography, which may be considered in more complex cases where other investigations have been inconclusive. And MR venography can also be used when non-invasive tests are inclusive and surgery is being considered. Some potential other differentials for varicose veins include DVT, and this because deep vein thrombosis can present in a very similar way with a pain, a swelling, redness, or discoloration and warmth of the lower limbs, as well as chronic venous insufficiency, which is also characterized by chronic edema, skin changes such as pigmentation or eczema, and also venous ulcers. Another top differential is superficial thrombophlebitis, which may present as a firm, red, tender vein and can be associated with other symptoms such as fever. And peripheral arterial disease, although not as much of a differential, but it can present with intermittent claudication, non-healing ulcers, and in severe cases, breast pain, making it a differential for varicose veins. Now, to treat varicose veins, we want to apply conservative medical and surgical management. So the typical conservative management includes lifestyle modifications. So if they have a occupation that involves them standing for long periods of time, we'd want to reduce standing for long periods of time as much as possible. We can also elevate the lower limbs where possible to encourage venous return, use of compression stockings to apply pressure to the varicose veins, weight loss if they have a high BMI, and regular walking can also promote venous return. And in terms of more invasive procedures that can help to manage varicose veins, the first being radiofrequency ablation. So this is essentially the destruction of the veins endothelium via a very high temperature catheter. And there's also endovenous laser ablation, which is the destruction of the vein using a laser injection sclerotherapy, which involves basically injecting a chemical or a sclerosant substance at several points of the veins, which leads to them collapsing and occluding. Or we can apply surgery such as avulsion therapy or strip the vein via surgery. And some of the common complications if we do not manage and treat varicose veins includes venous ulcers, in advanced cases skin discoloration due to increased hemosiderin deposits, and an increased risk of hemorrhage, as well as increased pain and a poor quality of life for the patient. And therefore, this is a condition that we really want to target and treat as soon as possible. Thank you so much for listening. If you have any questions below about the topic, please feel free to comment in the comment section below, and please like and subscribe. Thank you so much.